with the first author, Dr. Sridivya. Is she here? Come. Yes, sir.
Good evening. So my topic is MGD in India, what to do. Our international workshop on MGD has described MGD as chronic diffuse abnormality of the meibomian glands characterized by terminal duct obstruction along with qualitative or quantitative changes in the glandular secretion. Dysfunction in meibomian gland secretion can adversely influence the amount and also the quality of secreted meibum, leading to alterations in tear film compositions and compromising ocular surface health. This will result in tear film abnormalities, ocular surface inflammation or irritation, or ocular surface diseases. The aim of our study is to compare the efficacy of basic treatment modalities of meibomian gland dysfunction. All the patients in our study, they belong to lower socioeconomic group and cannot afford expensive treatments. Our objective is to give better treatment at reasonable price. So it's a prospective cohort study with 120 patients, 2 groups of 60 each. In the first group, we have given only warm compressions and lid hygiene along with supplementation of lubricants for 1 month. Whereas in the group B, along with these, topical antibiotics were also included. These are the parameters on the study: symptoms by OSDI questionnaire, tear film assessment, ocular surface staining, and eyelid morphology. We have excluded patients with seborrheic dermatitis and acne vulgaris. Coming to our results, while we see improvement in symptoms in group A, there is 40%, and in group B it is 90%. Improvement in eyelid morphology is seen in 32% in group A and 82% in group B. Ocular surface staining betterment is seen in 28% in group A, and group B it is 76%, whereas tear film assessment is almost same in both the groups, that is 68 and 76% respectively. In general, when we come to the different treatment modalities of MGD, regular eyelid compresses with warm water once or twice daily, followed by a firm massage to express insufficiented secretions, is a beneficial treatment. Artificial lubricants, topical antibiotics like azithromycin and emollient or liposomal spray may be considered case to case. Topical 1% ophthalmic solution of azithromycin is a broad spectrum macrolide antibiotic with anti-inflammatory properties. The most important thing in MGD is its daily eye care regimen. That is warm compresses for 10 minutes, cleansing the eyes with baby shampoo or lid scrubs, and using preservative-free eye lubricants. Without proper maintenance, MGD will worsen and the number of meibomian glands will eventually decrease. As the disease progresses, symptoms worsen and prescription medication or surgical intervention may be necessary. There can be permanent damage to the eye and vision loss also in some cases if left untreated. It's a chronically recurring disease. Patients will tend to have temporary relief. Symptoms usually reappear after some time without ongoing treatment. Hence, patient education is essential to ensure maintenance and regular follow-up. The limitations of our study are we haven't separated the MGD into, like we didn't classify it basing on its severity, and acute and chronic differentiation was also not done. Coming to conclusion, MGD is a very prevalent yet often overlooked disease leading to underdiagnosis and undertreatment. Many patients are asymptomatic in the early stages, complicating its prompt diagnosis and intervention, and it's mostly an incidental findings on slit lamp examinations. Better improvement was observed in patients with topical antibiotic usage along with lid hygiene and also lubricants. Thank you.
Thank you so much. What was the general age group in which you have picked up the patients?
Sir, it is from 20 years to 60 years.
And what was the predominant age group which was
It's generally 45 to 60 was predominant, sir.
And what is the rationale behind putting eye drop instead of applying it on the lashes or
Sorry,
the lid
sir?
margin?
I didn't get it.
You said that the azithromycin eye drops were used.
No, sir, eye ointments.
Eye ointment. Okay. Fine. Thank you.
Thank you, sir.